Hi friends, we are live at our YouTube channel SLP Sanjay Kumar Voice Therapist, and with me Karthik is here, and Karthik is having a feminine kind of voice. So we'll be talking with him, and we'll again make live after the treatment also. And today is before treatment live. Yes, Karthik. So keep telling. I think there were some network issues, so I was not able to do properly. But anyway, you can go ahead.
My name is LSK Karthik. I'm 16 years. I've been suffering puberphonia since 2 years. Uh,
Yes.
uh, Due to puberphonia, my friends used to hurt me. Uh, and many times I've been called as madam on phone calls, voice calls, uh, and many other things. That
Okay. Okay. So anyone has made you fun of you because of
is
this problem?
my friends used to make fun of me. Uh, uh, During school breaks or lunch breaks, even when I have to uh, answer the question I'm asked, uh, I have to drink some water and then I have to uh, answer the question, speak out loud. Uh, that's it, sir.
Okay. So we are live at our YouTube channel.
Uh, yes,
Yeah, and this is I'm making this live. I'm making to create awareness about the voice problem and problem like puberphonia. Many people are having the problem, but they don't know where to go and how much treatment time it will take, and all
sir.
the details they don't know. So the idea of making live is to people should understand like this kind of problem can be treated, and I'm confident that this problem for you it will be treated about 8 days, maybe 1 or 2 days plus or minus, but I'm confident and it's very
Just
very
one
easy to correct.
place.
Yeah, about 8 days it will
Uh,
take.
okay,
And why this problem occurs I'll explain to you, and maybe it will
okay.
help others also, those who are watching
Yes,
our
sir.
YouTube channel. During
Yes, sir.
puberty there will be some changes, hormonal changes, and because of the testosterone hormone in case of boys, the mass of the vocal cord, length of the vocal cord increases. So when mass will increase, length will increase, pitch reduces. Okay.
Okay,
Uh,
sir.
you have seen the guitar.
Yes, sir. Yes, sir. I've seen that.
So there will be two kinds of string. One will be thin string and other will be thick string. So thin string, what kind of voice produces?
Normal voice, sir.
Means high pitch voice,
Voice.
shrill voice.
Okay,
And thick
so
string produces low pitch voice, more like a masculine kind of voice.
voice. Okay, sir.
Okay. So just yeah, we'll be checking some questions will also be coming. So thin string produces the high pitch voice and thick string produces
Low pitch
low pitch
voice.
voice.
Light
So
pitch.
during puberty, because of the testosterone effect, the vocal cord which was thin earlier, but now it becomes thick because of the testosterone hormone. And when
Yes,
it's
sir.
become thick, the voice should be low pitch, more masculine. But
Yes,
what
sir.
is age your age now?
16, sir.
So at this 16 age, I'm expecting the your vocal cord mass should be like normal, but still your
No.
pitch is higher. And you are telling when you call to the pizza or something order on the phone,
Uh,
they say madam to you. So
yes, sir.
the mass of the vocal cord, length of the vocal cord has increased. So now the string is thick. But because of your childhood to till puberty habit, you have not accepted the change which has happened during the puberty. So in it means like your vocal cord, suppose this is the vocal cord. So you are vibrating only thin edges of the vocal cord. So vocal cord is thick but behaving like a thin string. And when the guitar string will be thin, the pitch will be higher.
Yeah, yeah, sir.
Okay. So what I'm going to do, I'll be stimulate your whole mass and the whole length of the vocal cord. And once it will be whole mass, one whole length will be stimulated. So the string which was behaving like a thin string, now it will start behaving like a thick string.
16.
And when the string will behave like a thick string, then it will the pitch will be
My
low.
voice is like my masculine voice.
Yeah, so it's very very easy to correct it, and many people don't know, so they take some time medicine also different kind of. But this live we are trying to create awareness, this kind of treatment is possible by the voice therapy. And I'm suggesting to people, those who are watching our, you can subscribe our YouTube channel. Those live we are doing pre-therapy, we'll do the post-therapy live also. And
Yes,
if you don't have the communication problem, then also please subscribe and share, and just motivate us, because maybe some people will be having a communication problem, and this video will give a ray of hope in their life.
yes, sir.
Okay, so hope those who are watching this at this time, they will be at least subscribing and sharing with among their friends, and it's indirectly helping. And the most
Yeah,
important thing, I
yeah,
am from India, and many people from different countries are coming to our centers. It's a proud moment for our India also.
yes, sir.
So in that way also you can think like how Indian speech language pathologist is changing the life by changing the voice. Okay, so Karthik, what's
Mm.
your career plan? Just I want to talk so that people can hear your voice.
Uh, Career plan, I want to become a graphic designer or a CSO.
Okay.
Uh, I've taken a special course in my 11th standard and 11th standard, CXCA course,
Mm-hmm.
uh, become CSO. I'm also interested in computers. Uh, I also draw good, better. I also want to become artist. Uh, that's it, sir.
That's great. So there are some people who has joined. So let me just talk to them. And thank you, Riaz. He is telling good evening. Good evening to the Riaz and the
Uh,
Mohit Sani. Thank you for joining. There are many people who have joined. I just want to say thank you. And yeah,
yes,
yeah, so thank you everyone for joining and listening us. And I will suggest to go to the our playlist of YouTube channel, so you'll get more ideas like what kind of services we provide. And if you explore more videos, so we tell the date also before therapy and after therapy, so they can find out how much the duration of treatment. So there is no universal rule for this problem, this much only time it will take, but based on experience and based on my evaluation, I can say in Karthik case, it will take near about 8 days plus minus 1 or 2 days. Okay, but
yes, sir.
others problem, those who directly calling to us or messaging us how much time it will take. So first we'll do the perceptual evaluation, and if we'll be able to understand your problem, so we can give a rough idea. Sometime we will not be able to exactly tell how much time
Mm,
it will take.
how much time will
Yeah,
I
but
understand.
based on experience, in few cases we will be able to tell you. Okay.
Okay.
And apart from treating purophonia feminine voice, we also provide voice therapy for the people having the vocal cord paralysis, and because of that, there is a hoarse and the breathy voice. And those who are having the stammering, stuttering, in Hindi we call haklana. And we also provide the voice therapy for the people whose voice has suddenly gone and the vocal cords are normal, and it's called functional aphonia. So we have seen a good result. And those who are having pitch and loudness issue in the voice, they also can take the advantage of our voice therapy services. So thank you, Karthik. Thank you so much for
Mm,
becoming live and for the
thank you for
creating
taking my
awareness.
problems. Mm.
So those who have joined newly, Karthik, tell about your problem. Maybe they will hear and they will get an idea.
I'm suffering from Puberphonia since 2 years, sir. Uh, around the age of 14, around the age of 14 or 15. Many of my old friends started noticing that my voice has changed and is sounding a little high pitched than before. Uh, and after a few months, suddenly my voice changed and my voice started sounding like a feminine voice. Uh, because of that reason, I could not participate in any stage competitions or talk properly to friends or ask out during classes.
Mhm.
Uh,
So I'm now
but,
it's
mm,
yeah. So I'm telling
mm,
now because of this voice problem, it will not
mm,
affect your career. We'll correct
Yes.
this, and I'm very much confident in about 8 days. And
Mm.
now you'll be able to participate in other debate competition and other things. Okay,
Thank you, sir.
this voice will not hamper your career growth.
Mm.
Okay, so या तो एक पूछ रहे हैं अशरत अहमद कि आपको कांटेक्ट कैसे करें। तो बहुत ही सिंपल है, आप हमें कॉल कर सकते हैं। अगर आप इंडिया से हैं तो 080 420 41980 पे। अगर आप इंडिया से बाहर हैं, इफ़ यू आर आउटसाइड इंडिया, यू कैन कॉल अस एट 9180 420 41980 from Monday to Friday from 10 a.m. to 7 p.m. and on Saturday 10 a.m. to 5:30 p.m. So very easily you can contact us, and you can go to our website www.speechtherapyindia.in, and there you can click reach me, and there you will find our email ID, contact number, and other details, Google Map also. So in that way also you can contact. So thank you, Ashad, for contacting, and thank you.
You can also check the number and the website on the description, sir.
Sorry.
You can also check the number and the websites in the description, sir, video description.
Yes, yes,
Yes.
yeah. So thank you, Riaz, for recommending us. Riaz is recommending us. Thank you. Uh, and and so we can stop today, I think. Yeah.
Yes, sir.
And one more thing, I'll be adding
Mm.
things. Now the people, those who are unemployed, they are because when they will make video and they put in the YouTube, so some money they can earn to become a YouTuber. So they are
Yes.
not a professional speech language pathologist and voice therapist. They don't have the training. So they will be putting some video. This technique will help, that technique will help, and they will try to just use those technique and making a video. And some people in the comment box, they will following to them, and they will use those technique, and now they will be reaching to our center after developing the vocal nodule and vocal polyp, sometime phonatory gap. So vocal cord is very important for you. Those who are watching this video, I'm telling to my fans, and you should respect and give importance of it. Don't take treatment from the quacks. Don't practice any exercise those have been suggested on the Google or YouTube. To become a speech language pathologist, good speech language pathologist, we study 4 year bachelor, 2 year master, 6 year, and watching 6 minute video, you can't become a voice therapist. So try to understand, keep healthy your voice and vocal cords. Otherwise, it will be a problem. And so, and
Mm.
even those who will do the quack practice, the Rehabilitation Council of India will take legal action also. So those who are trying to find a career opportunity, be careful. So it will be become a legal issue for them also, because Rehabilitation Council of India is the governing body. So those who are working in the rehabilitation field and communication disorder. So if you are doing a quack practice, so if something is becoming wrong or even somebody complains, so there will be problem. So just and try to avoid the quack practice, especially for the quacks. Because nowadays I'm seeing those who are not speech pathologists, they are also making video of speech therapy,
Mm. Yes, sir.
and they are explaining the techniques. And sometimes what will happen, some of the people, they will show the changes at the level of counting, like 1 2 3 4 5. But in the Puberphonia treatment result, 1 2 3 5 1 2 3 4 5 saying in a low pitch voice is not the end of the treatment. The patient should able to talk in comfort way at the conversation stage, then only the treatment is over. So those who just know incomplete information, they will also try to make some video and showing the changes at 1 2 3 4. And when you try, your plan is to take the voice therapy, you should contact speech language pathologists, not other healthcare quacks and other professionals. And if you are getting impressed by someone's video after watching the YouTube channel of somebody's, so try to find a pre and post therapy video. Suppose that YouTube channel consists of n number of patients, so out of that n number, how many you are able to find and pre-post, and in that how many pre-post, the changes they are showing at the conversation stage, not saying 1 2 3 or amma appa or abcd.
Mm.
So try to make yourself smart, and so that you should not get cheated. Especially those who are my fans and watching this, I'll be
Mm. Yes, sir.
recommended. Okay, so Thank you everyone for watching us, and thank you so much. So we can correct this. We can just uh, sorry. We can stop here, and thank you everyone for watching us. Thank you so much.